Okay, so the first thing that I wanted to cover in today's chapter is the difference between a disorder and a disease. A disorder is an irregularity or a disturbance or interruption of the normal functions, whereas a disease is a particular distinctive process in which the body causes a specific characteristic or symptom. So a disorder would be something that constantly happens on a regular basis that's out of the norm, whereas a disease comes out of nowhere and is very, very distinctive in what it does, where a disorder is just, it doesn't work exactly how it should. Where a disease, it's very specific on what it is doing that it's not supposed to be doing. Does that make sense?
Yes.
Okay. So we have a lot of different things that we are going to cover today. So we have the lesions of the skin, the gland disorders, skin inflammations, pigment disorders of the skin, hypertrophies of the skin, skin cancers, contagious diseases, and acne. So disease is only a healthy response to an unhealthy environment. So it's not actually entirely a bad thing. It's generally trying to tell you that you are somewhere that you shouldn't be or touched something that you shouldn't have. So it's more of a alarm system. So the first one, before we get started, this particular chapter, I did include a lot of images. So some of them may be not very settling to your stomach. If you have issues with looking at gross pictures. But it is important for you to be able to recognize these conditions when you see them with a client. That way you can make sure that you stop them at the earliest stages before they get to where they cause more problems. So just a warning in advance. So the lesions of the skins are structural changes in the tissue caused by injury or damage. So you have three different types of lesions. You have primary, secondary, and vascular lesions. So the first lesion is your primary lesion. Your primary lesions are flat, they're non-palpable, which means you can't feel them really in the skin. The changes in the skin will be color or by elevation formed by fluid in the cavities. So that's why you'll be able to see like the nodules or the plaque, that sort of thing. But it won't actually really change the underside of the skin. So you have your, and I apologize for my poor pronunciation of any of these words. If you know how to pronounce them correctly, please correct me. So we have bulla, which is a large blister containing watery fluid. So that would be the third image on the top. You have cyst, which is a closed sac containing fluid and or an infection, as well as other matter above and below the skin. That would be the second picture on the top. The macule, which is a flat spot or discoloration left after a pimple has healed. So that would be the fourth image. Nodules, which is that first one, which is a small bump caused by scar tissue, fatty deposits, or infections. And I went out for some reason. Papule, which is a pimple containing no fluid. So these are one of the things that you'll most see because this is part of when you think of acne. Pustule, which is a raised inflamed papule containing fluid. So this is when you think of like blackheads, whiteheads, that type of thing. Those are pustules. Then you have a tubercle, which is an abnormal rounded solid lump that is larger than a papule. A tumor, which is an abnormal cell mass. A vesicle, which is a small blister with clear fluid or irritation. So those ones would be image number 3 on the bottom, whereas the pustule is image number 4. And then you have a well, which is image number 2 on the bottom, and that is an itchy, swollen mass, generally caused by an allergic reaction. It's also commonly called like hives, but it's generally an irritation, an extreme irritation to a certain thing that happened, whether you got bit, you got something on your skin, you ingested something, then you'll get wells or hives. So those are your primary lesions. Your secondary lesions, these are the later stages of the disease, and they change the structure of the tissues or the organs. So the other ones, the skin was still intact. It had a condition on it, but the skin itself wasn't damaged. Secondary lesions is actually completely changing the skin. So first you have crusts, which are dead cells formed over a wound or blemish. They contain pus, sebum, or epidermal matter. So these are basically what you think of when you think of a scab. You have exuration, which is a sore or abrasion caused by scratching or scraping. They do have a condition that is Acne X-Ray, which is a disorder where clients purposely scrape off acne lesions, causing scarring and discoloration in their own skin. So if you notice something like that, that may be the cause of that issue. There's fissures or fissures, which are cracks in the skin that may penetrate to the dermis. That's this second picture on the top. Keloids, which are a thick scar from excessive fibrosis tissue. A scale was an excessive shedding of dead skin cells. That's the top third picture. Then you have a scar, which is a discolored, slightly raised mark on the skin formed after an injury. So you can actually have a keloid one, which is just naturally occurs from an excessive amount of that tissue, or you can have one caused by an injury. Then you have an ulcer, which is that first image, which is an open lesion with pus, a loss of depth to the skin, as well as deep erosion or depression in the skin. So it's actually causing the layer of skin to sink into the rest of your body. Then you have atrophy, which is a thinning or absence of the epidermal subcutaneous fat. So that's this one over here, this atrophy. Basically, what's happening in atrophy is that your skin is essentially dying constantly. So your skin is very weak and it's getting worse and worse constantly. Then you have this lentrification, which you see in this first picture on the bottom, which is an abnormal thickening of the epidermis. This is generally easily confused with calluses, but it will generally be seen on the insides of your, in between your fingers and your toes. It'll also appear on your client's elbows. And it's just an overuse, an extreme overuse of that skin causes the raising of the skin, but this one is an abnormal one. So it's not a callus where you're like, oh yeah, I can tell by your hand that you are a writer because you have those two calluses on your fingers, on your pointer and your thumb. This one, it happens even if they're not actually using that skin the same way that you would if you had calluses. This is just, it randomly happens. Well, not randomly, there's a reason, but there's no specific cause being like, oh yeah, painters always get this scab here. This just happens. We generally, as estheticians, will only really deal with primary lesions. Once you see a secondary lesion, that is where you are going to immediately direct them to a medical professional. The other one that we very slightly will deal with is vascular lesions. Vascular lesions involve blood or a circulatory condition that is causing an issue. And these ones I will definitely mess up the names. So you have papillae, which is a small lesion of bleeding in the skin. So you can see it in this second picture with these little red dots. So this is generally caused by a small irritation, such as shaving or something like that. You'll get like strawberry legs, that type of thing. But it generally will go away on its own. Purpura or ecchymosis is a larger lesion of bleeding in the skin. That's this second one, or this first one that you see. This you'll generally see in your older clients, just because their skin is a lot thinner, and anytime they bump their elbow on a counter, their skin will start to bleed, but it won't actually cause these cause an opening in their skin, but their skin will still bleed. So it's just a very, very, very extreme bruise. Then you have telangiectasia. That's this third one that you see. Telangiectation is damaged capillaries that are now larger or distended blood vessels. This is a very extreme version of telangiectasia. Normally you'll just see these little veins that are spidering off the ends right here. And you'll see it mainly around your client's nose area because they're over exfoliating or over irritating their skin with a skin product that they are using, or how they are applying that product because they're being a little bit too aggressive to their skin. Varicose veins are those big purple veins that you'll see on the back of your client's legs if you're doing leg waxes. They are abnormally distended and twisted veins. You cannot wax over varicose veins just because the skin is so delicate and sensitive, and you'll actually have a very high chance of causing bleeding if you do. But they're those raised, and they're actually raised up on the skin, veins that are generally like a bluey, purpley color. Then you have rosacea. This is probably one of the ones you most commonly, this one and very minimal telangiectasia are the ones you'll most commonly see of the vascular lesions. Rosacea is an inflammation of the skin, a dilation of blood vessels, and possible papules and pustules. So people that have this condition, they have to be very careful what they eat, as well as what they use on their skin, just because their skin is so sensitive. There are treatments for rosacea, but it is not currently able to be cured at the moment. But they're still working on possibly curing it. Right now, we just have ways to minimize the symptoms. Okay, so can one of you name a primary, secondary, or vascular lesion, and then the other one name one that wasn't named? And it just has to be one. So yeah, what is one primary lesion? Okay. Then we have the gland disorders. And the gland disorders, you have two glands. So you have your sebaceous gland, which is where your sebum comes out of, and then you have your Pseudoriferous gland, which is where your sweat comes out of. So these are the disorders of those two specific glands. So with your sebaceous gland, these will be your oil glands. You have acne, which is a chronic inflammation of the skin disorder, and it is commonly known with pimples. Acne is caused by a number of reasons. It doesn't mean that your client is dirty. It doesn't mean that they have too much oil on their face or anything like that. It just means that the oil that is naturally in their face and is healthy to be in their face, because that is what keeps your skin supple, is being trapped in their skin for some reason. That is what's causing the acne. And it generally will happen with hormonal changes. Certain medications will cause it, that type of thing. That's why you always have those high schoolers that always have it, is because they're going through puberty, which has significant hormonal changes in your skin. Then you have arthrosis, which is a dry, scaly skin from sebum deficiency. So that's this top picture here. So this is because the skin lacks oil. It can't regulate itself properly. So then it dries itself out. Then you have comatose. These are non-inflamed buildup of cells or sebum or other debris, and they are the main thing that you see when you're actually thinking of acne. So they'll be, when the comedote is open to the air, it becomes a blackhead because the oil that is in their skin has oxidized and it turns itself black. When it is closed, it will be white because it doesn't have that air, because it's trapped underneath the skin. Then you have a frenicle, which is a sebaceous abscess filled with pus, also known as a boil. So that's this image with the blue gloves that you see over here. And when multiple are right next to each other, they are called carbuncles. So that is a group of boils. So they kind of like pile on top of each other, which is what this image is. The image above it is Malilla. And Malilla is a small, firm, white papules or epidermal cysts, and they're generally perfectly round. You mostly see them around your client's eyes, like you do with this client here. And that is just because they have an excess of dead skin cells building up on their skin. So that is caused by not exfoliating and that type of thing. Or just having an excess buildup of dead cells, which can be addressed by exfoliating. Then you have Sebaceous Hyperplasia, which is white, yellow, or pink baleen lesions. I couldn't find an image for this one. It is generally, it looks like a donut because it's a round circle that has a depression on the inside of it, right in the middle. So that is what sebaceous hyperplasia looks like. Seborrhea is a severe oiliness of the skin. So they generally look very greasy all the time, no matter how much they wash their face. And it's not just, oh, you have oily skin, you have excessively oily skin to where I can actually see the buildup of oil on your skin. Then you have seborrheic dermatitis, which is inflamed, dry, or oily scaling or crusting without the itchiness. So dermatitis is any type of itchy irritation to your skin. So this is the irritation to your skin because of your sebaceous gland. Then you have, keep doing that. Your stedoma, which is a sebaceous cyst or tumor that is filled with sebum. I also could not find an image for this one. But this one is a cyst caused by the oil, and it is filled with an excessive amount of sebum and oil. So you'll generally have to direct them to a dermatologist or a medical professional, and they will have to lance it off of their skin or lance it open. Then you have your pseudoriferous gland disorders. So these are your sweat gland disorders. So you have your anhydrosis, which is a deficiency in the perspiration caused by fever or in a different skin condition. So it's the inability to sweat due to fever or whatever it is. Then you have Brom Hydrosis, which is the foul-smelling perspiration, usually on the feet and armpits, caused by yeast and bacteria breakdown on the skin. So if you have abnormally, even if the client uses deodorant, smelling of the armpits, feet, that type of thing, they might have Brom Hydrosis. Then you have Hyperhidrosis. This is an excessive perspiration caused by heat, genetics, meds, or other conditions. So that's my little image down there. It's not actually as extreme as that, but basically you sweat an excessive amount for little to no reason. And it's caused by heat, genetics, meds, or other conditions. Then you have Malaria Rubia. And this is an acute inflammatory disorder of the sweat glands with red vesicles, burning, and itching from overheat exposure. So that's this top image right here. So these ones, when they start to sweat, it burns, it itches, and it's just basically they got heat stroke, but whenever they sweat. And the anhydrosis is such a deficiency, just bringing it back to this one, with their sweat. It's this image of this boy right here. Why he has absolutely no hair at all on his body is because your sweat is used to regulate your body temperatures. So he can't regulate his own body temperature because he cannot sweat. So that's why he'll get really, really red, because his body cannot cool itself down. And having hair and everything like that causes your body to be able to retain heat better. So those are your gland disorders. And feel free to unmute yourselves and ask questions if you have any. The next one is skin inflammations. So the main one that we have in this section is dermatitis, which we talked a little bit about earlier. So it is an inflammatory condition of the skin. Because anytime you see derma, that means skin, and anytime you see itis, that means inflammation or inflammatory. So it's an inflammatory condition of the skin. Okay. Then you have atopic dermatitis, which is a chronic dermatitis of dry, cracking skin caused by allergies. So this is when you are just allergic to, pollen, or you have seasonal allergies, you'll get atopic dermatitis. Contact dermatitis is inflamed skin by contact with an irritating substance or chemical. So this is if you actually touched, more of those aggressive chemicals, you'll get contact dermatitis. Sometimes you'll get contact dermatitis if your skin just doesn't like it. So you could have contact dermatitis from touching fabric softener. You could have contact dermatitis by using certain soaps or certain cleaning chemicals in your house. You'll get contact dermatitis, which you can clearly see what it is that's causing it, like this one up here. They have contact dermatitis to a certain type of metal, which is why you can clearly see where the ring on that finger was because of that contact dermatitis. Whereas the one that you see on this knee, you can't really tell what caused it, and that would be your atopic dermatitis because you can't tell what's actually causing it. Your perioral dermatitis is an acne-like condition around the mouth. It forms small clusters and papules. It is not contagious, but the perioral dermatitis is basically just dermatitis, a skin irritation around your mouth. Eczema is a acute chronic lesions. They can be dry or moist. So these ones are the ones that you'll have to where it's in very specific areas. You can treat that client as long as the eczema is not in a flare-up stage because it will cause the eczema to spread. If it's not in a flare-up stage, as long as you don't touch that particular area, it's then becomes a not a systemic condition or contraindication, it is a localized contraindication. So as long as you don't touch that particular area, you won't spread it unless it's in a flare-up stage. Then you have your edema, which is swelling from fluid imbalance in the cells from injury or infections. And that's just your normal swelling that you have. Erythema is a redness caused by inflammation, so that will kind of always go along with the edema. It's just when your skin turns red because it is irritated by something. Folliculitis is this top one that you see of this man's head. It's hair growth under the surface causing a bacterial infection, also like ingrown hairs, but you can see it specifically on the back of his scalp. Psoriasis is a chronic itching, patching of the skin covered in white scales. So it looks very similar to eczema, but psoriasis is generally more with your older clients, and you'll find it on the knees, on the elbows, and those types of areas. And it's very, very itchy. And the skin is very, very dry, where eczema can be dry or moist. Psoriasis is always dry. Urticaria are hives or an allergic reaction by the body's histamine production. So this is just hives that you get from an allergy, especially if you have a very severe allergy, you will get hives. Then you have your pigment disorders of the skin. Pigment can be affected by internal factors such as hereditary or hormonal fluxes, as well as intrinsic factors, so outside factors, such as sun exposure. So you have your hyperpigmentation, which means an excessive amount of pigmentation, and your hypopigmentation, which is a lack of pigmentation. Is everybody tracking so far?
Yes, ma'am.
Okay. So with your hyperpigmentation, this is when you get darker because you have an excessive amount of pigmentation. So you have chromosa, which is increased in pigment in certain spots, which is kind of what this top picture looks like. You have lentigo, which is yellow or brown flat pigmented areas, which look very similar to lentigines, which are what is actually a freckle. So this top picture that you see is actually lentigo. But chromosa would just be if you had this in one area. So if he only had it on a spot on his hand, it would probably be closer to chromosa. Melasma is hyperpigmentation caused by hormonal changes. These ones is this bottom picture here. So because of her hormonal changes of being an adolescent or getting a lot of acne, then she'll get the melasma, which is this pigmentation that you see on her jawline. Nervous is a malformation of the skin from abnormal pigmentation or a dilated capillary. It is what we commonly know as a birthmark. Then you have our very scientific medical term of a stain. These are brown or wine-colored skin discolorations with circular or irregular shapes. That's this middle picture. I kind of thought they would have a more medical term for this, but no, it is just a stain on the skin. Then you have the always coveted tan. This is the melanin produced by a sun exposure, and I'm sure you all know what a tan looks like. So it is actually hyperpigmentation when you get a tan, because it is the melanin producing more than it normally would because of the excessive sun exposure that you had to get it. And that is whether you are getting it from a tanning booth, salon bed, or whether you actually get it from the sun. Then you have hypopigmentation, which is the lack of pigmentation. So this is when your skin gets lighter for whatever reason. So you have leukoderma, which is a loss of pigment creating light or abnormal patches. So that is where you'll see it, this top one right here, where this client would normally have very dark skin in like a Fitzpatrick 4 area. They now have patches of skin that put them, those patches look more similar to a Fitzpatrick 2 or 3. So their skin is getting lighter in very weird patches. This one is specifically around his mouth. Other ones, it can be around your hands, or it can just be in random patches all over your body. Then you have albinism, and this is a genetic condition displaying a lack of any melanin in the hair, skin, or eyes. So this little boy right here, his hair is completely white. His eyes are incredibly pale, and he has basically no coloration to his skin. He has albinism. So he is from a South African family, I believe, is what it said on the image of it. But both of his parents look very South African, with a Fitzpatrick of 6, and he basically has a Fitzpatrick of 0 in his skin. He has no melanin in his skin whatsoever, which makes him very, very sensitive to sun exposure, and he'll have a lot of other medical conditions because he has that lack of melanin in his skin to protect his skin and his hair and his eyes. With your vitiligo, this is a complete loss of any pigment in patches. So this is what you see on this woman's neck right here. So in small patches, she has a complete loss of any color. And it will actually get worse if she's in sun or anything like that. It will start to spread to more of her skin. And you can get a more in-depth description of any of these in your guys' textbook. So those are your pigment disorders. Then you have the hypertrophies of the skin. So a hypertrophy is an abnormal growth on the skin, and it is usually benign, which means non-cancerous, not actually going to hurt you, but something that's generally uncomfortable. So you have Acne Keratosis, which is pink or flesh-colored precancerous lesions that feel rough and sharp, resulted from sun exposure. Then you have hydrokeratosis, which is a thickening of the skin caused by a mass of keratinocytes, which is this one that you see on this man's toe at the bottom. You have keratoma, which is an acquired thickened patch of the epidermis. That's the one that you see on this thumb here. You have Keratosis Polaris, which is a redness and bumps in the cheeks or upper arms caused by a black follicle. You'll see it on the arm right above the toe. So because the follicle is blocked, it's causing these bumps in the skin. So you have to open those bumps back up to unblock the follicle. Then you have moles, which is the top picture with the white gloves, which is a pigmented nervous, and it ranges in color and size as well as shape. These ones you want to be very aware of because they do look very similar to cancerous lesions. So if for whatever reason it changes shape, changes size, changes color, you should advise your client to seek medical professional to double check to make sure that they're not a cancerous lesion. You have skin tags, which is this top left picture right here. So skin tags are small growths of or extensions of the skin that look like little flaps. You can easily get them removed. They don't cause you any harm. They just generally are an irritation because they get snagged on things. You'll generally find them around clients' eyes or their neck, chest area. Then you have Varicose, which is a hypertrophy of papilla and epidermis caused by a virus. So this is what is commonly called a wart, which you all know what warts look like. So these are the abnormal growths of the skin, which are your hypertrophies. And then going off of the moles, you have your skin cancers. This is one of the main ones that you do want to be very familiar with just to make sure that your client is as safe as possible. Because as estheticians, you see your client more than they see their doctor. And you generally see more of the client than a lot of the people that the client is in contact with, because you're waxing her legs, you're giving her a facial, occasionally you'll give body treatment, so you'll see her entire body, and you would be the one to notice if anything changes in her skin before anybody else, especially if it's on an area that your client cannot see. So you have your basal cell carcinoma. These are characteristics include open sores, a reddish patch, or a smooth growth with an elevated border. They're this top group of pictures. So that BCC, that's your basal cell carcinoma. So anyone that says that is part of the basal cells. So they are shiny bumps that are lightly colored, and they are the hardest to spread, but they will still actually spread. So if you notice any of these lesions on your clients, be sure to advise them to seek medical attention. Then you have your squamous cell carcinoma. These are red or pink scaly papules or nodules. They, as well as open sores, they have a crusted area that doesn't heal. So it is constantly bleeding or constantly scabbed over and just doesn't heal at all. They spread a lot easier than basal cell carcinoma. So these ones you want to catch as fast as possible because they do spread a lot faster. So these ones are the SCCs that you see over here. Then you have your malignant melanoma. And the reason that this one is in red is because this is the most dangerous of the skin cancers. So you really want to make sure you're aware if your client has this condition. They are black or dark patches, usually uneven in texture. They're very jagged and they could be raised. They could also, unfortunately, be tan or white. These ones spread the fastest. It is super, super easy for malignant melanoma to spread throughout the body. So this is why anytime you see any abnormal patches or anything like that on the skin, you want to advise them to seek medical attention because it is easier to treat if it is in a smaller area. So these bottom ones here, the top are the normal moles, and then the bottom ones that look very odd and very discolored and raised in different shapes, those are your melanomas, these bottom ones that you see. Right here. So your normal moles are on the top, and your melanoma is on the bottom. So you want to be very aware if you see any of those to advise your client to seek medical attention as soon as possible. The way that you tell the difference between a normal mole and a cancer mole is A, B, C, D, E. So asymmetry, the two sides of the lesion are not identical. If they're not identical, it could be cancerous. The border, which is an irregular border on the lesion, you want to check the color. If it's darker and multicolored and fading in some spots, it is generally more cancerous. The diameter, at least the size of a pencil eraser. And then evolving. Any of your cancerous lesions on the skin will change their appearance. They'll start looking like a mole, and then at the end of it, they may start looking like this, and then they'll start looking like this, where they have that discoloration, where they don't really match, and then they start getting shiny, and then they start raising in weird places that weren't raised before, and then they get bigger, and then they spread. So you always want to be very aware of any concerning patches on your client's skin and make note of any changes that those areas have. So those are your skin cancers. The next one that we have are your contagious diseases. This one is the most graphic of my images. So you have conjunctivitis, which is pink eye, or commonly known as pink eye. It is an inflammation of the mucous membrane, which is the conjunctiva around the eye, due to chemicals, bacteria, or viruses. You will mainly see this in clients that deal with a lot of children. Adults generally don't get this condition unless they catch it from a child. The next one that you have is the picture right next to it of the lips. And that would be your herpes simplex 1. So these are fever blisters or cold sores, and they are a reoccurring viral infection. So you'll generally see them around the mouth and that type of area. So these are your herpes simplex 1. Any type of herpes that you have, there's 3 types of herpes, are incredibly contagious, and they cannot currently be cured. So you can treat the symptoms of herpes simplex, but you cannot cure it yet. So the next one is herpes simplex version 2, which is genital herpes. So it looks this exact same as what this client has on his lip as what they would have in their genital area. The next one is herpes zoster. This one is also known as shingles. It is a reaction reactivation of the chickenpox. So if you had chickenpox as a child, you may have herpes zoster when you get older. So these form red blisters that occur in a ring or in a line that, so it's the one that you see on this client's chest. This is herpes zoster. So it is a line that is on his chest and it kind of forms a ring. They're extremely painful and they can cause organ damage as well, just because of how aggressive this disease is. Then you have impetigo. And impetigo, the one that you see on this child's lip, is the one that you'll mostly see. So it is a bacterial infection that causes small blisters or crusty lesions that are filled with bacteria. So this is what you'll generally see. The one on where it's on the child's nose and mouth area, that is when the impetigo gets worse. So this is an extreme form of the impetigo when it doesn't get treated. And impetigo is very easy to treat. You just have to go to CVS and they will give you a nice cream that you can put on it, and then you don't have to worry about it. But if it is not treated, it will get very worse and have more pus and more chance for it to get infected because they are open lesions. It can be around the mouth, it can be behind the ears, and it is very, very contagious. Then you have TIA, which are any type of fungal infections. So like athlete's foot, any of those. Those are all in your TIA. Then you have TIA corpus, which is ringworms. So they formed a ringed or raised edge. You can see it on these bottom pictures here, where it formed a very distinctive red circle with a white center. Those will all be your ringworms. Then you have your warts, which you all know what warts look like, which is the hypertrophy of papilla and the epidermis caused by bacteria. So warts are also very, very contagious. If you notice your client has any of these diseases, do not treat them. Do not give them a service. Not only are you putting your client at risk by causing their condition to spread, you are putting your other clients at risk and you're putting yourself at risk. So wait until the condition resolves itself, and if it is a condition that cannot resolve itself, then they probably just will not be able to get that type of service until they find a solution to those. Then you have your most common skin disorder that you will ever come in contact with as an esthetician, your acne. So the causes of acne are, it could be genetic / hereditary. So some people have a predisposition to already have more acne than somebody else. Clogged follicles, bacteria, stress, hormones, cosmetic skincare, and products, especially if they're expired, as well as food. Some people, if they drink milk, they'll get acne. Some people, if they eat sugar, they'll get acne. And some people can eat sugar all day long and never have an issue. So it really does depend on the person. So you have 4 grades of acne, and the first 2 is mainly where estheticians are going to be working. which would be your minor breakouts in grade 1, are your minor breakouts, mostly open comedones, so those blackheads, and then you'll have some white closed comedones of your whiteheads, and then a few papules, which are those raised bumps that do not contain pus. Your grade 2 have many closed comedones, many blackheads, more of those open comedones, and then your occasional papule and pustule, which is the pus-filled papule. So your closed comedones are your white ones, and your open comedones are your black ones. Grade 3 acne is a slight area that you could kind of step into as an esthetician, but generally it is where you would then send them to a dermatologist. So it is red and inflamed, and it has many comedones, papules, and pustules. Once the irritation that is connected with grade 3 resolves itself, you as an esthetician can work on it. But you do have to get that skin to calm down enough for you to actually do acne treatments on it. Grade 4 is always going to be a dermatologist. This is where your cystic acne is. So you'll have cyst, you'll have comedones, papules, pustules. It'll have a lot of irritation, and these ones will actually cause the skin to scar and be permanently damaged, is your grade 4. That is why the dermatologists with a lot more medical background have to deal with this area, because there's nothing as an esthetician that we can really do for these clients other than make it slightly less uncomfortable. But the dermatologist will actually be able to treat this client. So you have your pre-acne, your acne, which is your comedones and a little bit of congestion, your acne 2, which is your papules and pustules in more abundance, your grade 3, which is your severe papules, pustules, and maybe a few nodules, and then which has the more redness and irritation. And then you have your grade 4, which is nodules, cysts, and scarring, and extreme discomfort, which dermatologists will deal with. Because at that point, it's going past the epidermis, which is where we hang out, and is headed to the dermis level, which is where they hang out as dermatologists. So those are all the diseases and disorders of the skin. Did you guys have any questions about anything? Anything you wanted me to go in more in depth about? Anything like that? Okay. Well, then that is all I have for you on your diseases and disorders of the skin.